Test. All right, I think we are live. Hey, Joanna. I was just putting in a message. Thought I would make myself a little cup of tea and see if I can get this new desk set up to work. Just moved back into this room. I don't know if you've seen any of the other videos. They're usually in the garage. But it's getting very cold in Australian winter. And so it's nice to have a room like this inside. My garage is not very well insulated. Last winter, I was making all these videos in my garage and it was -3 degrees. So the part of me is kind of proud that I had that kind of grit, but I don't have it anymore. I need more comfort. So I've moved into this little room and everything's a bit new in terms of the setups, and not sure it's going to work great with live streams. I know that this microphone isn't the best. I couldn't make the other one work this morning, but I just wanted to make my little cup of lemon and ginger tea and have a little chat. And we've got a couple of people joining. That's lovely. Hey, guys. Warm welcome. Oh, thanks, Joanna. I'd be very curious if if you guys can help me with the setup, that'd be great. I mean, is the audio quality acceptable? It's probably not like crispy, minty fresh, but is it good enough? Yes. And we've got Leslie and Shelby. Oh, good to hear. And we've got Shelby all the way from Texas. Hey, welcome. And Vermont. Look at that. We've got a crew building. Nice, guys. Very welcome. I'm happy to hear the audio is acceptable. This is probably the most simple setup that I can muster, so that's a good thing. Just having a cup of tea and checking in and seeing how everyone's going. And I thought it might be nice to build a bit more community this way, a bit more of a sense of community. That's right, Drew. Back when I was young, about 2 months ago, I had a head of hair, and now I'm bald. Look, I think receding hairlines are coming in. There's that guy from White Lotus who's, I don't know, I just saw like some Facebook post saying how receding hairlines are coming back in. I'm not against one day just letting all my hair grow out and just having like a thin, long, kind of crazy scientist hair. But I tried going fully bald, and the irony was that it was way more work than having hair. I thought it would be just you shave all your hair off. Naively, I just thought you'd forget about it. You just shave your hair off and you're bald forever. You have to shave 3 times a week. If not, you get like just these really little, like you're like just almost bald all the time. And so I found that actually, if I just do this, if I think this is like, it must be 1.5 mil. It's really short. And if I just keep it at this length, I can just do it once a week, and it's actually way less work. So I didn't think I'd be waking up Sunday morning, having a cup of tea and talking about my hair care routine, but this is actually the most low maintenance and actually quite cost effective. Like I never need a haircut again. It is an interesting experience for my ego. I did used to have like a kind of head of hair, and I felt like I had a classical doctor look, and my hair was thinning, and it felt, I would grab my hair and it would feel just like I'm balding. Like, just lean into it, Sil. Just accept it. And instead of going to Turkey and getting plugs, I actually did go to Turkey, but I went with friends, not for the goal of getting hair. But I saw a lot of people getting hair transplants, and I thought about it, but I rather just lean into reality as it is and take the hit. It's a bit of a hit, but that's life. Life is that we're all imperfect. Better lean into it. We got Washington. Welcome. Jenny Claver. Yeah, welcome. Yeah, close buzz all the way. Hey, I hope you don't mind. I'm just going to read through some of these messages because it's really nice to see that there are people online at 8 a.m. in Australia. It must be really late in the States. I'm not going to Google it, but what time is it in the States where you guys are? Felicity, or Fel, sorry. Narcissistic personality disorder and narcissism. I think it's a really interesting area of psychodynamics, and culturally probably reinforced that people have these narcissistic personality structures. And it needs to be approached with empathy, but also with healthy boundaries. Yeah. Mac attack on lithium with hair thinning. That is a side effect of lithium. Lithium's a very tricky but incredibly good medicine. Just needs to be done well. Like, it requires monitoring and close surveillance of the blood level, and it's very effective for things like bipolar disorder. Probably one of the most effective medications for bipolar disorder. And if someone has a bipolar 1 disorder, it's seen as probably the gold standard treatment, but it comes with side effects and needs blood tests and needs kind of good level of understanding from the patient's perspective. They need to understand that if they're sick and vomiting and having diarrhea, that the level can become unstable, and so you need to get more frequent blood tests and sometimes change the dose and things like that. So it's not a simple medicine, but it's an important medicine. I hope you're finding it helpful for whatever reason you're taking it. So some people are just joining in the afternoon. Germany in midnight. That's naughty, fella. You should be getting your sleep hygiene on and getting ready for bed. What is everyone's kind of pre-bedtime routine? Let's get a little conversation going around healthy bedtime routines. Maybe we can inspire Phil to start relaxing and go to bed. Leslie, lithium can come with some pretty horrible side effects, and just with every decision around medications, it's about making a collaborative decision with your doctor around the risks and the benefits. Some people are on lithium as an augmentation, and some people are on it as the primary treatment. So augmentation, what I mean is it's an additional treatment to improve their other treatments. So you just have to have a discussion with your doctor and make sure you guys are on the same page. I think it's helpful to do lots of research yourselves, go into the reviews with information and questions, and then you can make a more informed decision. Thanks, Holly. That's a lovely message. Holly saying that she found a channel a couple months ago and helped with sort of the nursing mental health stuff that she's doing. Nice, Holly. That's mental health nursing is incredibly important. It's probably underrated, actually. It's really, especially on mental health wards, it's the nurses that get the most exposure to patient behavior. And so I've seen, patients say, I've seen patients say, like, I'm completely manic to the psychiatrists, and the psychiatrists kind of considering a diagnosis of mania. And then when they get collateral information from the nurses, the patient's sleeping well and is very settled, and realize that actually there's just this, whatever the case is, it's a different presentation to what the doctor is being presented as. And that's why we have to be really cautious with diagnosis. People come in to see me and say, like, what diagnosis do I have? And you got to be, to diagnose based on one single cross-sectional review where you spend 1 hour with someone across the lifespan, and to make a diagnosis that could imply a lifelong illness, it's, you know, sticky and tricky. You gotta be really sure, because someone, half an hour or an hour is not much to go by for making a whole mental state diagnosis of someone. So you've got to be very sensible with diagnosis in psychiatry, and often people do get their diagnosis revised and changed. Oh, that's interesting, Phil. Oh, nice one, Phil. Yep. Well, please enjoy the ride into that sweet slumber. Quetiapine is a really a helpful medicine for a lot of people, and especially it's got such a wide dose range, which makes it a really interesting medication. Like, people can take it from 12.5 milligrams up to 10 or 20 times that dose, depending on what reason they're taking it. And so it can be really helpful for mood stability and sleep. It doesn't come without side effects, but hopefully in the lower range, the main side effect is, usually tolerable, or even people, that's what they're seeking. They're looking for a kind of relaxation. Yeah, nurses are the eyes and ears. That's true. Martin asking about thoughts around sertraline. Oh, look, I can't make any personalized medical advice in this kind of forum. Of course, you understand that. But I would say that a lot of antidepressants aren't needed for lifelong use. That major depressive illness and generalized anxiety disorders and lots of the other indications that antidepressants are taken for can be episodic. Many people just don't take them forever, take them for a period. But, and this is a very important but, and I hope this is something I can say, in this forum, and I hope people listen closely. Coming off of antidepressants can be very tricky. So must be done well. Some people can just stop it, I'm sure, but the majority of cases should be done quite slowly. And it's called, I forgot what the name of the curve is called, but like an inverse asymptotic dose titration. So like, you want to, at the lowest doses, you want to go very slowly. There's a curve that shows the receptor occupancy at these doses, but essentially what you want to do is you can go from like 20 milligrams to 15 milligrams to 10 milligrams of escitalopram, for example, pretty quickly. But then from 10 milligrams to 0 milligrams, you want to do that very slowly. I won't give any kind of protocols on this live stream, but talk to your doctors about how to come off of medicines, and the slower the better, really. Because the really tricky thing is if you're coming off of an antidepressant, for example, and you get withdrawal effects from it that cause anxiety, then you're like, oh crap, my anxiety is coming back. But it could be your anxiety is coming back. It could also be withdrawals, and that needs to be assessed by a doctor and assessed, and it can be really tricky. So it's not easy, but less is more. If you can have less medications, then good. Often medications help people build, this depends on the illness, but often medications are useful in a short to medium term while people build psychological strategies to manage the reason they were on the medicines. So say someone had a fear of public speaking or severe anxiety, they might be on an antidepressant to help with the anxiety. And then as their anxiety improves because they've been working with a psychologist to build techniques and the medicine has helped reduce the intensity, then they can come off the antidepressant, for example. Anyway, this is all speculation and generalizations, no medical advice in this forum, of course. What can you do with PTSD when a defense mechanism is depression? Wow. That needs to be talked through with a therapist. I don't think I can do justice in this live stream. I would say that that depression is a very complex term, and that by itself, depression isn't a defense mechanism. But introjection is. So, if someone's had a traumatic history and they develop a depressive personality because they've experienced trauma and negative ways of seeing the self, and they've internalized these negative ways of seeing themselves. So having a caregiver say negative stuff to you, and then that being internalized and being a way you talk to yourself, and then obviously having a depressive view of the world, low mood and low self-worth and stuff. That's tricky and may very well need medicines. It needs to be seen. You need to see a doctor and a therapist and collaborate. But it takes time and a good therapeutic alliance. And sometimes if someone has a deep depressive personality structure, well, sometimes it needs like more than, like sometimes psychodynamic therapy is needed as well, depending on their kind of level of functioning and stuff. So usually you'd start with, it depends on the person, but if someone has difficulty in emotional regulation and distress tolerance, you might start with some therapies like dialectical behavioral therapy, where people learn how to be mindful, self-soothe, tolerate negative emotions, especially with PTSD, when flashbacks can regress someone into a horrific state of panic. Because all coping mechanisms can get thrown out the window when someone, all I should say, second order or mature or adaptive coping mechanisms get thrown out of the order if someone's having a flashback in PTSD. It regresses you into a childlike terror. And I don't mean to say it's childlike, but it's regressed. Like you can't use mature ways of managing a flashback that's causing a panic attack. I hope that's clear. So really tricky, lots of therapy, maybe even medications, depends on the person's illness. But depression's episodic. It does respond to treatment. There are a lot of treatment options out there. There's pharmacological treatments. There's non-pharmacological treatments. There's even neurostimulation treatments. And psychedelic therapies on the horizon, and even ketamine and lots of different kind of new age advances coming. But I think when someone has a depressive personality, it's tricky because medications by themselves can't change the way someone thinks, right? So after DBT, you might think about CBT or other types of therapy that can challenge the negative ways of thinking. But such a tricky thing, so these dual diagnoses with PTSD and depressive personality and introjective defense mechanisms, like really, really tricky. And my heart goes out to people who suffer like that. Oh, Holly starting a mental health placement in an acute adult inpatient ward. Really looking forward to it. That's excellent, Holly. Well, I mean, I've worked on inpatient wards. Really interesting place, and nurses make all the difference. Are you doing it as a nurse or a medical student or social worker? We'd be interested in clarifying that. My advice, if you're like junior and going onto a mental health ward, is it's very tempting to be a little over familiar and over friendly, to try and be the savior and try and be the kind of one that helps someone get out of a crisis. And that's great. You're wanting to help people. Just keep your wits about you when you're a junior, because there can be some people on the ward that unconsciously and not with malevolent intent, but can burn you out, like really can take advantage isn't the right term, but you know what I mean? Like if you're over-invested, you might neglect other patients because one patient is particularly attached. So it's about maintaining healthy boundaries, respect, presence, connection, but limits as well. So not sharing personal information. Don't talk about what sports team you're with. I've seen all sorts of things happen, and there's the people talking about their personal life. It's important in a lot of reviews to give a bit of yourself, right? But the art is in knowing how much to give and in what way to give it. So if you're junior, just probably stick with someone else in all your reviews. Don't see anyone alone, and talk to your supervisor if you had any interesting experiences or connections. Ulbeck asking, what kind of environment am I working in? Thanks for asking, Ulbeck, and I'm sure you have wonderfully genuine intentions. I try not to talk about where I'm working at any point of time. I try it. I mean, it's a weird thing, this YouTube, because it's separate but connected to my work, and I don't represent a workplace, but I certainly shouldn't talk about my workplace. So yeah, I probably just won't comment on where I'm working at the moment. But thank you for your question, and please do keep asking questions. I appreciate it a lot. Vida asking, is there a chart to choose antidepressant? No, and I can see you having fatigue issues. So there really isn't. Different doctors will just start on different antidepressants and maybe focus on side effects as the main decision maker as to what to start with. I don't think I've ever started an antidepressant. Usually a GP has already started it. So by the time people come to see me, they've already tried multiple antidepressants, usually. Now, I'm sure I have started an antidepressant at some point, but it's more infrequent. It's more frequently the case that they've tried others and it hasn't worked. So antidepressants, you try one, and usually the class is called a selective serotonin reuptake inhibitor. But interestingly, the data suggests that if one doesn't work, it doesn't mean the others won't. So you should try another in the same class. And then you can try changing. And I guess you need to think about differential diagnoses. If antidepressants haven't been working, some people have like a bipolar depression that hasn't been, and you just haven't had a manic episode yet. So you have to think about whether to treat it like a bipolar depression. But yeah, you need I think if two antidepressants haven't worked, you should start thinking about seeing a psychiatrist or someone with mental health expertise. Please don't minimize the importance of therapy, right? The best evidence for most mood disorders and anxiety disorders is combination of both medications and therapy. Combination. Oh, cool. Someone's put my name in red. I'm still learning how all this works. I have a goal. Sorry, I'm just having a look at how this YouTube live stream is working. Can YouTube algorithms lead you into a paranoid rabbit hole and give yourself the symptoms of being described in these videos? I'm not sure which videos you're referring to, James. Paranoia, though, is a very interesting and possibly quite debilitating symptom. And there's people who have paranoid, personality structures, and the core defense mechanism there is, it's tricky, but some people have a projection issue where they might feel everyone's out to harm them, but actually they're projecting an internal anger or like an unprocessed, unconscious emotion onto others. That's what Nancy McWilliams would argue, at least, and it's interesting to think of it in those kind of psychodynamics. But yeah, paranoia can be so severe that people develop things called paranoid delusions, where their beliefs are probably not reality based, and can cause significant harm. But like YouTube algorithms can definitely put you down rabbit holes, and whether there's a paranoid element to it or not is probably something worth exploring with a therapist or a doctor. Okay, that's a really interesting question. Is there a link between bipolar disorder and one's personality structure? This is a question from Mollum. Absolutely. This should probably be its own video, actually. That's a good one, Mollum. I've been making lots of videos just chatting with people. So what's the nice way to... So look, if you had a bipolar illness, especially if it comes out in your, whilst you're developing your sense of self, like in late teens, I guess, it's going to affect your personality structure. But also, some would argue that adverse childhood experiences increase the risk of developing major mental illness like bipolar disorder. And so they also increase the risk of developing personality disorders. So it's very hard to disentangle it. What's also very common is misdiagnosis of severe emotional dysregulation of people who are operating in the borderline level of personality organization, which means that at times, especially in stressed states, they can regress into psychosis and look psychotic and look manic or dysregulated and get a diagnosis of bipolar illness or schizophrenia. But then at other times they operate in a non-psychotic state. So and it's tricky because you don't always want to give sedating medications to people who have problems with dissociation and sedation. So yeah, it's tricky. Diagnosis in psychiatry is an art. But I would say there is a strong connection, but it probably warrants its own video more than I can do justice for here. Dennis, is Vervance more effective than Concerta? That question assumes that everyone has similar responses to different medications, and it's not the case. Honestly, there's no way to know for sure which one will be more effective in a patient without trying. And so usually just, some psychiatrists, by the way, as a psychiatry trainee, we don't chart stimulants. I've attended talks and things on it, but we don't. It's not really in public psychiatry in Australia. We don't initiate treatment for ADHD, I should say. But honestly, you can't really know without trying low doses of either and then building it up and seeing what works for different people. Oh wow, Mom! 15 years you've been thinking about that. That's the nice thing about YouTube, isn't it? I love YouTube. I'm a really big fan of it. I was watching a video yesterday of this guy in Norway just building his own sauna, and it's just amazing that this guy in Norway making these silly videos of him building saunas, teaching me so much about building and what life in Norway is like. It's amazing that that's happening on the other side of the world, and I'm just here in Australia having a cup of tea in front of my couch watching it and laughing. It's really funny. I really want to build my own sauna. I'm trying to save up for building my own sauna. I think saunas are amazing. If anyone in the chat has a sauna, I'd love to know what model they got and if it worked. Because apparently you just live forever. If you do a sauna 4 times a week, you just can't ever die. It's great. That's a joke, by the way. But it does reduce all-cause mortality, and people say it feels amazing. So I've done saunas in gyms and stuff, but my goal would be to especially in Australian winter, to go into a sauna in the morning when it's freezing outside, just get super hot, and then just cold shower and that kind of thing. Yeah. It's got to be traditional sauna. So it's hot rocks, and then you put the water on and it gets steam. Yeah. Oh, peace. I don't know. I'm sorry that you're feeling really low and feeling rubbish at your job, but it would require a psychiatric review to get to the bottom of what's happening there, and I can't do that in a live stream. So my apologies, but please do seek help. Oh, cheers, VSF. That's very kind. Wow, the myth. That's an interesting question. Do we think more research in understanding malingering is needed? So malingering is when people are displaying illness behaviors for secondary gain. It's a weird thing, isn't it? Because, it's an interesting thing to research. So, for example, someone might be saying, I'm psychotic, but the main reason they're saying that and displaying symptoms of a psychosis is so that they can have accommodation in hospital, or maybe some other secondary gain, like they've committed a crime and they're wanting to be seen as psychotic, so they're not responsible for the acts of a crime, so malingering. And it's a tricky one. We don't see it that often, but when you do, it's kind of very difficult to manage. More research, sure. Yeah, I guess I'm not involved in research funding allocation. Probably a good thing. I don't know what I would fund. Just making decisions as to what research to fund is very tricky and requires a lot of ethical thought, because there's what the world's interested in and there's what the world needs. And often much of the research doesn't go into the most important. I mean, if research was going into the most important areas of effectiveness, then it would all go into prevention and exercise, diet, and lifestyle. But we're still very much focused on treating chronic illnesses that come from lifestyle issues. So pretty tricky area. Wow, this is so nice, guys. So I think, most Sundays I can do this. Sorry, my room's a bit of a mess behind me, I just realized. But yeah, most Sundays I can do a little live stream. We can have little chats and do little catch-ups. So I'll do my best to try and do a regular live stream. And for me, it's just about, if you're satisfied with this audio quality and video quality, then that's very easy because it's plug and play. But yeah. We did have a topic of conversation, by the way. It was nice sleep hygiene and bedtime routines. What's everyone doing? So I'm keen for everyone to share what they do to help improve their sleep and their kind of pre-bed routine. For me, my bed routine is usually hang out with my partner, watch some TV. And she's a night owl, and I go to bed early. I'm really tired by 8 p.m. I'm tired. I want to go to bed usually by 8 p.m., but usually push it till 9 because I'm crazy like that. Gosh, live streams make you do silly things. Sorry about that. Yeah, so by 8 I'm sleepy. I might watch a TV show. What are we watching at the moment? Oh, The White Lotus. Not sure if anyone's seen The White Lotus. It's pretty good. Season 1 was the best. I haven't been as impressed with season 2 and 3, but anyway, I hear Adolescence is very good, so that's going to be my next TV show. And then after that, I probably usually have a shower, and apparently hot water is helpful for temperature regulation and sleep. If you listen to Andrew Huberman, maybe, I'm not sure, but and I have a chamomile, which I love. Like I have this chamomile sleepy time tea and it has a bit of lavender in it. It's so good. That's like my cue that it's time to start relaxing. So after the tea, I sometimes read, but sometimes I just lie in bed and listen to like an audiobook. That's when I'm listening to Lord of the Rings at the moment, so it's nice. Harry Potter was the best. The best audiobook to fall asleep to is Stephen Fry narrating Harry Potter, because it was stimulating enough to be interesting, but never too, well, except for certain parts, not really too stimulating to keep me up late. And then I just, like, as I fall asleep, I take my earphone out, and then if I go into unconsciousness, yeah. If I'm not well, if my self-control is low, and I'm on the phone doing like shorts, I try not look at shorts. I try and look at it's probably not much better, but I look at like Facebook Marketplace. I don't even need anything. I just look at it. Or sometimes I'll look at sauna videos at the moment. That's probably my bedtime routine. Well, Mac Attack, sleeping is not bad. So if you need to go to bed earlier, maybe taking meds early is a good idea. That's one of the most common bits of advice I reckon I give, is like people saying, I'm tired in the morning, but they're taking their meds at midnight. It's like, well, try take it at 7 p.m. And usually that has a significant impact on getting started in the next day. It does affect quality of life, especially if it's sedating medications, but because you're missing out on your evenings. But risk benefits. Nice. So Lemith waking up at 4:59 to before the alarm. Isn't that interesting? You guys have that your body can wake up just before an alarm? Like, it's amazing that your body, I don't know, it happens to me a lot that like if I have an alarm for 5 a.m., I'll just wake up like 4:58 or something, or even if I'm tired, like my body can like pop me out just before the alarms do. It's so interesting. Oh, sorry, Mac. I think I might have forgotten that you were. I might have mixed you up with someone else who had a late time zone. Yeah. Oh, good night, Phil. Good on you for going to bed, and I hope it's a very nice slumber. My future live streams might be a bit earlier because it's getting 8:30, so I should probably get started with my day and finish off this cup of tea. I'm glad this worked, though. Has anyone used a sauna? Sorry, I'm really fixated on saunas. Anyone used a sauna and found that it's helpful for their mental health? Yeah, those stock alarms, Lemith, are terrible, aren't they? It's pretty rough. That's nice. This is really nice, guys. I remember starting YouTube 4 or 5 years ago. Gosh, it's probably been about 5 years. And having like just 3 people on the live stream, which was really nice. I liked it. I even played video games and stuff, and people would just hang out with me while I played video games. We'd just chat. So that was nice. But yeah, this is cool. Like this was unprepared, and already, heaps of people are joining and chatting and engaging. That's just lovely. Drew used saunas frequently, and between lifting in the sauna, those were the best days. Nice. Oh, that's a very nice point. Looking at the stars, that's a good idea, Holly, to have a spa. Yeah. I think saunas are far less maintenance than spas, if I'm right. But yeah, Poppy, cold water, very good for mental health. A lot of people who have problems with dissociation find cold water really helpful because it's very hard to dissociate when you're in cold water. It really embodies you. Yeah. Thanks, Lemith. I used to have a gaming PC. I sold it. Now I've just got a PlayStation 5. I have a PlayStation 5 and I love it. Well, I really enjoy it. And I'm just streaming off of my Mac. But yeah, it's been 38 minutes. Has anyone noticed any big issues with this streaming setup? At the start, people were saying the audio was good enough and that the video was good enough, so that's nice. To me, it looks really good. I probably should stop looking at myself so much and just separate the chat. Is there a way to pop the chat out? Yeah, pop out chat. Yeah, that's it. So next time I set it up, I'll do it like this. So I stop looking at myself and I can actually look at you guys and the chat next to the camera. Yeah, things running good. Thanks, Yin Yang. Appreciate it. Sweet. I wonder what happens if someone sends like an inappropriate message in the chat, because I don't have any moderators or anything. I used to, but I haven't done live streaming for so long. I kind of want to ask someone to like type the F word in the chat, but I don't want them to get banned. Yeah. There is a room echo on the mic. Okay. Yeah, the blurred background comes from the really good camera I'm using. The echo is good to note because it's the microphone is on top of the camera and it's a shotgun microphone. So I do have this, but I couldn't set it up in time for this live stream. This would be way better. But it's going to be a nightmare because when you use a separate microphone to your camera, it has a delay and you have to adjust for the delay in audio and visual. So that's going to be my fun project for the week. But that's a nice goal. Okay, for next Sunday, my goal is to get better microphone linked so that everyone can have a nice time. Yeah, that's a good goal. Anyway, guys, might leave it there. I wish you all a wonderful Sunday. Oh, that's interesting. Sauna better for females, cold plunge is better for males. I hadn't read up on that physiology. But yeah, no, thanks for liking the video, and thanks for supporting the channel. It's a really lovely hobby. I've been really enjoying it. And it's it's really special that I can just hop on a Sunday and then have a chat with all you lovely people. That's really great. Oh, look at all these nice messages. Martin, I would always slowly wean if possible, but you need to talk about that with your doctor. I can't give personalized medical advice on these chats. But thank you very much, everyone. That's a lovely live stream, and I had a great time. And now I'm going to get started with my day, and I hope you guys, wherever you are, have a lovely rest of your day. Bye for now.